We will discuss restless legs syndrome. Restless legs syndrome, as the name indicates, there is an uncontrollable urge to move the legs, typically worse at rest, especially during evening or night. When the patient is at rest, then the uncontrollable urge increases to move the legs. Key clinical features. There is urge criteria for the diagnosis of restless legs syndrome. First one is patient has an urge to move the legs. Second one is during rest these symptoms, that is urge to move the legs, is worsened. Third one is it relieves when the patient is walking, or rubbing also gives relief. And fourth one is during evening or night when the patient is at rest, it worsens. This is circadian pattern. So these four things. First one is urge to move the legs. Second one is rest worsens the symptoms. Third one is gets better with movement, and fourth one is evening or night worsens this condition. This is diagnostic for restless legs syndrome. Common sensations are patient feels creeping or crawling of insects, or tingling, pulling, paresthesias, or burning sensations in the legs. That's why patient moves the legs. This is not a painful condition but very distressing condition. Types. It may be primary, idiopathic. The cause is unknown. There may be positive family history, but it may be secondary to iron deficiency, anemia, pregnancy, chronic kidney disease due to uremia, chronic kidney disease leading to uremia. It can lead to restless legs syndrome. Diabetes mellitus, Parkinson's, and use of antidepressants and antihistamines. Of these, iron deficiency, anemia, pregnancy, chronic kidney disease, and diabetes are important causes of restless legs syndrome. Diagnostic essentials. Actually, it is diagnosed clinically, but you should evaluate for iron levels and serum ferritin levels, and also perform RFTs to check if there is uremia. Associated conditions. First one is insomnia and sleep disturbance. Then depression and anxiety may also be associated with restless legs syndrome. Daytime fatigue, because the person's sleep is also disturbed, and periodic limb movement disorder may be seen. Management. First one is non-pharmacologic, that is sleep hygiene, avoid caffeine and nicotine and alcohol, and also leg massage, warm bath, walking, and stretching, because walking, stretching, leg massage, warm bath, these all improve restless legs syndrome. If there is underlying cause known, then correct iron deficiency, like if there is iron deficiency anemia, correct it. If there is uremia, then go for dialysis. And if these don't correct the condition, then we should go for pharmacologic treatment. First line treatment is dopamine agonists like pramipexole, ropinirole, cabergoline. And alternative agents are, if dopamine agonists don't work, then we can go for gabapentin or pregabalin. Refractory to these treatments, then we go for opioids like tramadol or oxycodone, but these should be last resort because these also lead to addiction. Prognosis. It is chronic and uncontrollable. Primary form is lifelong, that is if it is idiopathic and if there is a history of family, then it is lifelong disorder. But if it is secondary, like due to iron deficiency anemia, and if underlying cause is treated, then this condition improves. So this is all about restless legs syndrome.